Hi everyone, Dr. Remy from Pain Free and Fit. Today, great video for those of you with low back spondylolisthesis. We're going to be going over some essential tips in terms of sitting and how to get in and out of the seated position without hurting your lower back. Hope you enjoy.
So when we sit with lower back spondylolisthesis, depending on your unique RPI neutral spine position, we have to take a few considerations in to reduce the pressure on the disc, the facet joints, and help to prevent pain. Most importantly, we need to learn how to set that position and hold it when we come up. So in a seated position, remember, you place more stress on the discs than you do when you're standing. When you're standing, there's typically more stress on the facet joints, the back portion of the spine that can cause spondylolisthesis pain. When you sit, because the pelvis has a natural slight posterior pelvic tilt when you sit, there's more disc pressure, but it relieves the extension or the backwards arching effect in the lower back, which many times mechanically drives that spondylolisthesis vertebra more forward, aggravates the facet joints, hypermobile ligaments, whatever's causing your pain. So in this position, it's good to figure out just how much of a pelvic tilt you need to be comfortable. Now, if I sit down and I roll my tailbone up and my pubic bone down, increasing the arch in my lower back, I'll notice at a certain point, I'll start to feel some discomfort in my back. Likewise, if I do the opposite motion and tuck my tail under and roll back, and you'll notice your upper body weight starts to go past those sit bones, those bones at the crease where your buttock and leg meet, and I decrease the arch in my back, I'll notice perhaps a little discomfort. Again, it really doesn't matter if your pain is more facet-driven or disc-driven. You're just going to try to determine in this, what we call sagittal plane of motion, where your neutral spine is. So if we increase extension, we feel a little pain. If we increase flexion, we feel a little pain. Then we're going to put ourselves right in the middle of that. We're going to roll our pelvis to that midpoint, the center between those two extremes that cause pain. That's my neutral or safe position in that unique motion. Remember, we have to combine various motions and various core muscle groupings to really get a full, complete neutral spine that's tailored or custom for us. But this is just one aspect of it. So once we get that set, we're going to think, can my chair hold me here nicely? Perhaps I need my chair seat to come up a little bit, because sometimes if a seat is too low, it's going to throw me into posterior pelvic tilting. So I'll need to increase the height of it to aid in that position where I don't have to use as much active muscle tension to hold me in that position. Likewise, if I have too much of an arch and I need to decrease it, if I need more of a posterior pelvic tilt to put me in that mid position, I'll choose a lower chair, or perhaps I'll put something under my feet to raise my feet up. Both of those measures will help to decrease the curve in my back. Of course, I'm going to avoid crossing my ankles and knees, because when you cross an ankle or a knee, it pulls one pelvic bone up on one side. That pressurizes the discs, pushes nuclear fluid to one side. Most spondylolisthesis patients have some degree of disc degeneration involved. It also torques the spine, the soft tissues, the facet joints. So we want to get used to sitting with our feet straight out, perpendicular to the body, where the knee and the ankle are aligned. Now, it's very important when we get in and out of the seated position to protect the spine as well. So once we set that neutral position, we want to try to maintain it when we get up. One of the biggest mistakes people have with spondylolisthesis that's aggravated with too much extension, meaning either tail up or leaning the upper body backwards, increasing the arch in the back and causing pain, is that when they go to get up, they increase right there, extension. Because if we didn't have some type of extension with our upper body, our bodies would fall forward as we try to get up. So we have to learn how to protect ourselves. And the way we do that is by rotating on the hip joints with the feet backwards slightly. So what I mean by that is you still are going to be that neutral position that we've set between too much anterior tilt and too much posterior pelvic tilt. We're going to hold that. But then we're going to allow the whole body, like we're squatting. You've seen many of our videos on the channel of proper squat form, where the top of our head, our ear, our shoulder, our hip are still in a line, except that line is slightly forward. And the reason it's forward is because I've pivoted my entire upper body and pelvis on the hip joint. I'm not anterior tilting with the upper body stationary. I've allowed the upper body to move with the anterior tilt of the pelvis. Do you see that? That's different. Usually that's going to cause pain if I keep the upper body right here and I just anterior tilt. But now I've held that neutral position, that midpoint, and I'm tilting the whole unit from head right through tailbone forward. So if I feel my lower back, and I invite you to take your hand and place it in the small of your back, that perfect amount of curve that you've set when you're sitting has not changed. It's the same amount of curve. I've just pivoted forward on the hip joint. And I pivot far enough from the hip joint and then squeeze the buttocks and come up out of a squat. And I'll do the same thing when I sit down. It's really all about squatting. Now, if you're new to squatting, there are some cheat methods you could use to assist this. One, having the feet further apart gives you a little more stability as you roll that pelvis forward. And you'll need a little less forward lean with that. You'll have to be a little more upright because that's like a sumo squat where the body is more upright. Or you could bring one foot back and one foot forward. Bring one foot under the chair, one foot forward. Hold that same position and come up in a split squat position. That'll often be a lot easier. If you try to use both feet underneath to come up, you're going to be coming up on your balls of your feet, and you're going to be causing a lot of forward motion with your knees. People with knee problems, people with foot, ankle problems, that may not be the best idea. So peppering in these techniques while you're sitting during the day, at home, at work, and when you're getting up and down from chairs throughout the day is going to go a long way to helping you prevent your problem. Check it out. Every time you're sitting, you go to get up. Stop for a moment, set that neutral spine if you've lost it during your sitting, and try either of these three techniques, either with the split stance, the sumo stance, or with the normal stance, but they all have that pelvic forward tilt without increasing the arch in the back because we maintain that postural alignment between head, shoulder, and hip, preventing excessive motion in the lower back. Plug this one in and you'll quickly realize that sitting will no longer be such an issue and you'll be helping your own body to heal your spondylolisthesis injury.
If you've enjoyed this video on self-help spondylolisthesis exercises, feel free to subscribe to our channel. We've got a lot of great videos out there to help you. Questions or comments, write in. As always, I'll do my best to answer. And remember, if you're looking for a great way to learn how to analyze your low back mechanics, how to construct exercises, and even a whole self-rehab routine to help heal and prevent spondylolisthesis pain, check out our Fast Track program for spondylolisthesis available at painfreeandfit.com. It'll walk you through all the various steps you need to figure out what your posture, movement, muscle imbalance, and low back stability issues are, and successive exercises to build up a good routine to help prevent the pain and assist your body in healing. And as always, if you're having trouble with your analysis or implementing exercises, I'm always available through Zoom for online consultations. I hope this video on spondylolisthesis and self-help exercise helps you with your chronic low back pain.